And welcome to week 3. This week we are going to be covering gender roles and gender. Some of the items that I do this week are the Chapter 5 Smart Book, your Chapter 5 quiz, gender roles video clip and questions, gender roles and expression blog, your gender photo scavenger hunt, finding peer-reviewed journals, and this is for your issue paper, and then of course discussion board. Some of the main topics this week include studying gender, gender roles and sexuality, gender learning, contemporary gender roles and scripts, and then gender variations. So most people distinguish their sex by their appearance of their genitals, what's between the legs. Others rely on their gender identity and how they feel. And culture encourages us to accentuate or invent psychological, emotional, mental, and behavioral differences between men and women. So what are we talking about here? I think it's important to define certain terms. Assigned sex is generally whether one is biologically female or male. And that is generally based on anatomical sex. What do you see between the legs? And assigned gender at birth is, again, what did the doctor see between the legs? Is there a penis or a vulva? But if we want to be more specific and more accurate, we need to look at genetic sex. And this is the chromosomal and hormonal characteristics a person possesses. So chromosomal is whether or not there is XX, which is female, or XY, which is male. And then based on those hormones is whether the body is going to produce estrogen for females or testosterone for males. Anatomical sex are now the organs and components. So are there ovaries? Are there testicles? Is there a penis? Is there a vulva? And so forth. But gender is not what's between the legs. It's what's between the ears. It's how one feels about their biological sex. And gender is rooted in culture. It's defined by culture. It's a socially constructed notion. Assigned gender, again, is the gender given by others, usually birth. And then gender identity is an internal sense. How do you feel in terms of male or female? So gender roles are attitudes, behaviors, rights, responsibilities associated with each sex. And there are also gender role stereotypes, which are rigid, generalized beliefs about the characteristics each gender should have. They tend to be false or misleading. And even if the generalization is statistically significant, meaning statistically it shows that most people do have a certain characteristic, it's not necessarily positive or conducive to hold these rigid beliefs about gender. So gender binary, our culture emphasizes that there are only two genders, male or female. Cisgender is a person whose gender identity matches their biological sex they were assigned at birth. And so everything matches in a cisgender person. So they have a penis, they're male, and they feel like they're male. On the other hand, transgender is a person whose gender and sex do not match. There's also gender variant or gender nonconforming. And these are people who question their gender or are uncertain or unwilling to state or feel limited by the categories of male and female. Other terms would include gender atypical behavior or gender identity disorder and gender dysphoria. But these are increasingly viewed as natural and normal on the spectrum of gender expression. So the gender we are assigned at birth tells us and others how to respond to us. And really, by the age of 2, we internalize and identify with our gender. Some individuals embrace a non binary option known as agender, bigender, genderqueer, gender fluid, or pangender. And these are people who believe that there's more than two genders, there's more than just male or female, there's a whole system in between. And some other cultures also recognize that sex and gender are not always divided along these binary lines. So, transgender is an umbrella term for those whose gender expression or identity are not congruent with the sex assigned at birth. Gender variation. So, there are many different variations of gender. And so, these are factors that are influenced by what are the brain's exposure to androgens. Androgens are hormones, the sex chromosome genes, XX or XY, brain structure. So the brain develops differently whether it's exposed to testosterone or estrogen. Social circumstances, as we've discussed, gender is socially constructed. And so the social circumstances one grows up and also helps define how you feel about gender. The family dynamics. And many people do find this idea of a gender continuum really hard to accept. And I believe most of it is due to the fact that many people grew up just with two genders, male and female. And so this idea that gender can be more than just two is mind-boggling for some. And also the idea of change, or perhaps they feel somewhere in the middle but are not willing to accept it, are also valid reasons why people find it hard to believe that that gender is more than just two. So transgender phenomenon. So transgender, as I said, is an umbrella term for all the identities that fall outside traditional gender norms. And it embraces the possibility of numerous genders and also multiple social identities. Androgyny is a combination of masculine and feminine traits, or also a non-traditional gender expression. So there are an increasing number of youth who are identifying as transgender, and these numbers continue to grow. Partly, in fact, is that the idea of being transgender is becoming more accepted in society, and so it therefore creates a community that it feels safer to come out as being transgender. And so perhaps more students are identifying as it because it is more accepted and it's safer to do so. So the model that's adhered by many healthcare professionals is that children who are insistent, persistent, and consistent in expression gender other than one that is assigned at birth should be able to socially transition. And what this means by socially transition is to come to dress and act and be referred to in the gender that they identify with. So in the face and the eyes of others. Not, and so this is saying social transition because there is conflicting research on whether or not sex reassignment surgery or sex affirming surgery should be conducted on youth. So gender dysphoria is a diagnosis that emphasizes the individual's felt sense of incongruence with natal gender, and this includes intense discomfort and distress. So many individuals live as their desired gender and may seek gender confirming treatments or may not. But there are separate criteria for gender confirming treatment, especially surgery, for children, adolescents, and adults. Are separate criteria. And then disorders and chromosomal variation. So these are physical or biological gender variations. These are also known as disorders of sex development, which is a range of medical conditions where there is a discrepancy between what you see on the outside and what's on the inside. So where we see this problem is that oftentimes, most times, I should say, when babies are born, the doctor looks, and if there's a penis, then they declare the baby male, and if there's a vagina or vulva, they declare the baby female. But there are some circumstances that would cause a penis to look like a clitoris and a clitoris to look like a penis. And then the identification of the sex at birth is actually incorrect because they do not know what's inside. They do not know the chromosomal structure, nor the hormonal influence on the brain. And so here are a couple of examples. There is the Turner syndrome, which is called 45X. But it's a condition among females where there's only one X chromosome. Then there's Klinefelter syndrome. And this is males that have one or more extra X chromosomes. They still have a Y chromosome, but there's an extra X chromosome. And therefore, what happens is that they tend to have tall statures, they're taller, they tend to have a lack of facial hair, tendency to lose chest hairs, a short trunk. They are at a higher risk for osteoporosis, and that's probably due to the extra X chromosome, since generally women are at higher risk. They have female type pubic hair pattern, an undersized penis, small, firm testicles, long legs, and a slightly feminized physique. And so slightly wider hips, and the way that the posture and the way that they stand tend to be more female looking. And there's also prenatal hormonal variations. And so these are not chromosomal, but how the hormones impact the body. So an example is androgen insensitivity syndrome. This is where a person who is genetically male, so XY, but is resistant to male hormones or androgens, so is resistant to testosterone. There's also congenital adrenal hyperplasia, which is a group of inherited disorders of the adrenal gland, and they can affect both boys and girls. And then we have the 5-alpha reductase deficiency. And this is where a genetic male will not produce enough hormone that's called DHT. And as you can see, it's related to testosterone. And so coming to terms with these differences in genders, there are a lot of rejections and loss, and there are common concerns for those that face gender transitions. And some feel that their only choice is either to transition or to suicide. But in reality, there's a lot of other choices that are available to people who don't feel comfortable within their gender. One of the examples I mentioned earlier was coming out social or social transitioning. In 2016, the US Department of Education and Justice issued a joint guidance for schools to ensure that all students are treated equally, that's consistent with their gender identity. Most societies do have a difficult time understanding and accepting gender differences, but professionals agree that the more one educates themselves and talk about the issue, the easier it gets to have a better understanding of the gender variations. Schools must provide a safe space for all, including students who identify as LGBTQIA and ally students. Title IX is an educational amendment that protects people from sex discrimination and programs activities that receive federal financial assistance. One of the most effective ways to come to terms with gender variations and in schools is this idea of self-acceptance, which can help students understand their own gender as well as the gender issues and differences of others. And the more one accepts himself and is educated, then the more one it can understand the different gender variations. So there are certain best practices that support transgender and other gender non-conforming students on campus. And these include adding the phrase gender identity or expression to the institution's non-discrimination policy, asking gender identity on college forms and surveys, allowing students to choose their gender and use a chosen name in records and documents, so it doesn't have to be the legal name, offering gender inclusive bathrooms and housing, and then enabling insurance coverage for therapies and, if needed, surgeries. This concludes our PowerPoint for this week. It is short and sweet, but there is a lot of work to get done. Have a wonderful week.